losses world over, the losses are rising exponentially. So even if it just reduce, actually, in my view, even if it reduce the rate at which economic losses are rising, that will itself be a big achievement. So that's one very specific thing about that, and it is sort of looked at in relation to global GDP. So I guess in the national context, we'll have to look at it in relation to our GDP. Infrastructure losses substantially reduced, but no specific percentage again. So the measurement period is 2020 to 2030. There is no specific mention in the language as to what is the baseline period against which we will measure it. And for all of these, we have 33 indicators across these seven this thing. I have just looked at the loss reduction targets. Before we look at what it means for our country, I want to show this simple graph, and the same data was presented in a different way by Dr. Thiru yesterday. This is looking at last several decades, starting from the early 90s, where we are looking at 10-year moving average. So if you're looking at 2005, then you basically are looking at from 96 to 2005, annual average for that period, and so on. So mortality in our country peaked in 2005 at something like more than 7,500 person dead per year. And in 2015, it was at its lowest. So if you look at this graph, you can celebrate that we have achieved 67% reduction in mortality. But as was highlighted yesterday, that 2005, the decade preceding 2005 was a particularly unlucky decade. We had the tsunami, we had the Bhuj earthquake, and we have this Odisha cyclone. So Odisha cyclone, you can say it has a lower return period, but earthquakes don't happen very often, and tsunami happen even less often. So, I mean, if we look at, this, the period of 2005 to 15 as baseline, and set that as the baseline and reduce mortality from there, we are forgetting that 2005 to 15, we've simply been lucky. We haven't had an earthquake. We haven't had a low frequency, high impact event. So how are we going to deal with it? I think we need to discuss that a little bit. So I'll just highlight, taking on from there, I'll just highlight a few issues that we need to grapple with at the national level. The first is that we have to take a view whether at the national level, we need to have quantitative targets, or we just go with Sendai and just say substantial reduction, and leave it to the states to decide whether they want to have quantitative targets or not for loss reduction. Some of the states, most notably Bihar, has committed itself to specific targets, 75% reduction in mortality, 50% reduction in number of people affected, 50% reduction in economic losses. So on what basis have they chosen 75, 50, 50? I don't know. I mean, is it just sort of a number around which you sort of galvanize action, or there is some scientific analysis behind it? I don't know. Then the second thing we have to see is at the national level, do we explicitly say that outlier events, 1 in 100-year events, we will take them out from the progress measurement, and we can define what those 1 in 100-year events are, whether they are hydrometeorological or geophysical. There is another way of looking at it, is that maybe we should sort of split the target and have the target, part of it looking at earthquakes and part of it looking at the rest, or the hydromet hazards. And for hydromet hazards, we can commit to a specific target, quantified target. And for earthquakes, either we don't commit, or we say that we will only have input-based this thing. How many hospitals have been strengthened? How many schools have been strengthened? And go like that. So I think that is something we need to sort of consider. Then the issues of inequality. I think this was highlighted very poignantly yesterday, that, which 30%, if we are reducing mortality by 70%, which 30% are we not going to be able to save? I mean, it is an important question to ask. And how are we going to make sure that mortality is reducing for all socioeconomic groups, and particularly for the most vulnerable, we are taking targeted actions, You know, there was one of the pre-events to this, this conference was a pre-event on food and nutrition. I mean, that is the kind of thing which will address the bottom 30%, you know, food and nutrition in times of disasters. The other issue to look at is the scope. The Sendai framework, as opposed to Hyogo, is not just dealing with natural hazards related disasters. It's looking at all hazards. So, which means, you know, it could be, the whole basket of hazards could be very large. So what are we going to include? What are we going to exclude? I think we have to take a decision on that. I think what is the kind of data we have on biological man-made hazards in terms of losses as well as risks? We need to take that into account. And of course, there has to be linkages. There is a big exercise led by NITI Aayog on SDG targets and indicators. It has been highlighted, the convergence is there. The way at the global level the indicators have been developed for Sendai, there has been a deliberate attempt to bring about coherence. So it's not a mismatch there. And of course, we have to work with the statisticians on this. Now, there are some issues that states will have to grapple with. Do states want to adopt all the 7 targets which are enshrined in the Sendai framework? The target 6 is on international cooperation. I can imagine that many states would not be very interested in that. On the other hand, there may be some states who would say that, you know, these targets do not meet our need because, you know, for us, road safety is a major issue, and let's have a specific target around road safety, even if it is not covered by Sendai. And actually, Bihar has done that. Bihar has committed to a specific target on road safety. So I think that is something we need to look at. Then again, the issue of whether we want quantitative targets. Then the issue of low-hanging fruits, in the sense that, you know, we have to reduce mortality significantly in a relatively short period of time. I think we will blink and it will be 2030. So can we look at some hazards? And the 2 that come to my mind are heat wave. Heat wave deaths are entirely preventable. You know, we've seen that in the last 2 years. We've reduced mortality from heat wave by something like 40%. And I think my sense is that this year we are doing even better. Lightning, you know, with some public awareness, some investment, we can reduce mortality from lightning very significantly. Should we encourage our states to say that, you know, the ones which are preventable deaths, just go for it, you know, be really focused on it and take actions and show tangible results by 2030. We'll meet the targets and we will have delivered something very tangible for our people. Then, of course, there is the issue of baseline. I mean, the issue of, you know, the previous speaker, the co-chair highlighted the problem with data. The issue, the current status of disaster data in country is not bad. It's extremely bad. And I think we really have to sort of sort that out. And, you know, this is something we have to put our minds and hearts to over the next couple of years. And of course, the same issues, connections with the development targets and statistical work. Now, how are we doing in terms of our readiness to actually monitor progress? We were supposed to complete a data readiness review by the end of first quarter. You know, the second quarter is more than half over, and we haven't even completed a review of how ready are we with respect to disaster data. So I think that is really a cause of concern. Database management systems. Last year we had you know, some interns from Tata Institute of Social Sciences working with us. We looked at 4 states, looked at what is the current level of data. Huge problems. The 4 states using 4 different kinds of systems. The data disaggregation at the local level, you have gender, age disaggregated data, but by the time it comes to the state level, you know, you lose that granularity. So how can you have informed risk management strategies if you lose that? So, and there are many other issues with that. There is also one issue which is an inherent tension between what do you collect data for? Do you collect data for immediate response or understanding the long-term trend? You know, sometimes, you know, data is collected to write a memorandum to the central government to get relief assistance. But for small disasters, there is no memorandum written, so there is no data collected, or it is collected very poorly. There are no standards there. So how do we sort of make sure that whatever system we put in place meets these twin needs? On one hand, it meets the immediate need of informing the response and recovery, whether it's a small disaster or a big disaster. And on the other hand, we systematically put in place a database which helps us discern long-term trends. There is also a big issue with regards to hazard characterization and attribution, definition. What is the definition of affected? You know, it's a complex issue to deal with. At the global level, it is also not sorted. It is something we'll have to grapple with in our own country. If there are linked events, if there's an earthquake which causes a landslide, which causes a flash flood, then what are you going to attribute the losses to? You know, which hazard are you going to attribute the losses to? So I think all of that, you know, in-depth discussion needs to happen. Definition of impacts, you know, like how do you call what are the damage categories for housing? How do we make it objective? How do we make it objective for different kinds of housing types? And finally, the issue of capacity development. In 2015, soon after the Sendai framework came into force, Ministry of Home did a series of 5 workshops with different states where a data collection format was discussed, statisticians were involved, but I think we have left that there somewhere. I think we need to pick up that initiative and run with it. We have only till 2020 to put a very robust system in place, and it will serve us not just for the Sendai regime, but also beyond that. Thank you very much.
Thank you, Kishore ji. Now I invite second panelist. The second panelist is Dr. D.N. Sharma from NDMA, but I am told that due to unavoidable reason, he couldn't come to make presentation. So Dr. Sarvdayal from NDMA will make the presentation to represent Dr. D.N. Sharma. And the topic of this panelist is monitoring of CBRN mainstreaming.
Thank you, Chair, Co-Chair, and Dr. D.N. Sharma is a visionary expert who has designed the CBRN vision for India, but unfortunately, he's grappling with some health issues, so on his behalf, I'll be presenting. CBRN mainstreaming and monitoring of the CBRN mainstreaming is an issue which even Sendai framework addresses with a bit of peculiarity. The reason is it's a very strategic and important issue, and it's related more with the security. So it is not usually discussed in an open forum, and I must congratulate the NPDRR because here first time this interface is happening between the civil domain. So when we talk of the CBRN emergencies, why we are very much concerned as far as the mainstreaming is concerned? Because a very thin line differentiates between disasters and terrorism. When we talk of biological disasters or chemical disasters and link it with the terrorism, the results are absolutely different, the modes are absolutely different, and the agencies involved are absolutely different. This presentation has been developed in guidance with Dr. D.N. Sharma, so we have restricted ourselves to the civilian domain. The NDRF, the armed forces, Army, Navy and Air Force are the prime agencies which are equipped, trained and are the prime responders in case of any CBRN emergencies. But how to deal with the increasing threat of CBRN perception in the civilian domain is what we are trying to address. So far, it has not been issued because it falls at an interface of defense policy as well as civilian and affects everybody in a major thing. Talking about a small history of the CBRN, it was originally ABC, Atomic, Biological and Chemical, in the time of World War II, which was then renamed as the NBCs, Nuclear, Biological and Chemical, in the 80s during the Cold War era, and after the 2000 millennium era, it has been defined as the CBRN-E and sometimes used as CBRN. The E stands for explosives. The UN resolution on CBRN threat says that the proliferation of nuclear, chemical and biological weapons and their means of delivery constitutes a threat to international peace and security. and calls on the signatory nations to refrain from supporting any means of non-state actors from developing, acquiring, and manufacturing, possessing such materials and delivering systems. The main important issue to this is increasing threat of CBRN. This very same day today itself, the UN Security Council is holding an emergency meet on increasing CBRN threat perception in the South China Sea. So these things are at a very global move on a very regular thinking basis, but India as a country has done itself a lot in CBRN scenarios. When we talk of CBRN emergencies and not just disasters, the several perceptions of several scenarios fall into under its purview. Whether we talk of chemical, it's a leakage that happened recently, or whether it's a tanker which can fall in on a highway or can affect the people living downstream if it gets into a river. Increasing threat, and the international health regulation says that the world is now a global village, and air transfer of any airborne or a pathogen is very much possible. We are equally exposed, despite being in India, equally to Ebola as well as other increasing pathogens. And agroterrorism, the terrorism by the means of which affects our biosecurity through plants as well as through the animals is also has been a threat to India in the past, as well as the increasing threat of radionuclear disasters by orphan sources which were missing on larger places in the world is also a threat increasing. How India goes ahead with regards to the CBRN preparedness is, when the Honorable Prime Minister released on 1st June 2016 the National Disaster Management Plan of India, emphasis has been given on CBRN preparedness as well. So exactly as in NDMA, NDMP metrics, mitigation metrics, when we define who will be doing what at the national and as well as at the state level for chemical as well as radionuclear disasters, and soon we'll be covering also the biological disasters. And the adequate need for preparedness, mitigation, and capacity building, which is now required for civilian domain as well for CBRN preparedness, has been also adequately emphasized in the National Disaster Management Plan. When the National Crisis Management Committee has assigned the nodal agencies and nodal ministries for any CBRN response, the Ministry of Environment, Forest and Climate Change act as a nodal ministry for any chemical disasters, and for biological disasters, Ministry of Health and Family Welfare, while the Department of Atomic Energy is a nodal agency for any radionuclear hazard. But in case of terrorism, Ministry of Home Affairs has a very important role to play and is the nodal agency along with several stakeholders. NDMA on its behalf has constituted several guidelines which includes chemical, biological and radionuclear disasters, and also the revision of these guidelines is also under the process. Why CBRN mainstreaming is required? Because it affects us all. I'll be sharing you a small incident when in the year 2005, during a student exchange trip, I saw a patient, 81 years old, female, who was suffering from leukemia. She was a person whom I got very interested in. The reason was she was probably one of the last survivors of World War II. She said that she was deputed in Hiroshima when the World War occurred and the bomb fell, but she had the training previous hand. I met her when she was 81. She might have been deployed at the age of 20 to 30s. Look at the preparedness other countries are doing in their past. She told me that as soon as the bomb fell, I was told that I need to get behind the hardest shelter possible. And as soon as my medical treatment started, I knew that my blood needs to get changed several times. Then only I will be good enough to survive. This time, the treatment has been replaced by the bone marrow therapy, but at that time, the frequent blood transfusion was the method used. The preparedness is the lesson that we learned from them. If we say, during the Cold War era, a lot of underground metro stations in the USSR were used as underground shelters for protection against the nuclear threat. Even today, in a country like India, we cannot say that the underground metro stations can be used as a shelter that will give any outburst message in the civilian community. So we have to tackle and deal with these issues on a very careful basis. And why it is required? Because the technological and scientific capacity has increased in both peaceful and military uses. There is increasing availability of dual uses of CBRN agents. For example, there are some Schedule 2 chemical agents which can be directly converted and very easily converted into Schedule 1 chemical agents which can be used for warfare group. And easy convertibility and for both chemical as well as biological, which can be cultured with a very minimum resource. Why it is difficult to mainstream? Because it's a very sensitive issue, as we again said, but the Sendai framework targets apply to CBRN mechanism also. As member Kamal Kishore said, that we have to look at the all hazard perspective when we develop the framework for implementing on the Sendai indicators. These threats are increasing day by day. But one thing we have to learn and analyze at this point of time, that at least the preparedness has improved drastically. It would be a wonder if we would have NDRF present back in 1984 when the Gopal gas tragedy happened. A lot of number of lives would have been saved. But the recent 2 weeks back, the Tughlakabad gas leak that happened, no lives were lost, and a very good response mechanism came in front of the country. The hospitals, 4 of them activated the disaster response mechanism. All the 603 patients were equally divided and very well managed. The result of it, what we want is, there were no deaths. This sort of mechanism needs to be repeated, and the community, the 603 people, why they got affected is an issue which we want to look in, and they should be sensitized to avoid such things in the future. The details of CBRN hazards are not known in public domain. So for developing the mainstreaming, we definitely have to bring, but again there is a question whether we should bring or not, because data and mortality and morbidity are available if you go on the international websites, on databases also. There is not a single data on number of deaths which is related to CBRN, terrorism events or military usage events. The data is only available on all the events that have occurred in the public domain. And CBRN being a very strategic asset for the country, the details of the stock, storage and security are not revealed in front of all. And the biggest blockade which we have as a fallacy in the country for the CBRN as well as weapons of mass destruction is, it cannot happen to us. They are so deadly that anyway we will not be able to do anything, and we all are going to die if such sort of attack again happens on us. But that is not true. We have learned from our past that mitigation measures for CBRN has played a very important role. When we analyze the threat profile versus the impact of CBRN, as we can see in the graph, we are most afraid of a nuclear bomb. But the most potent thing which can affect us is the smallest microorganism. Till date on the earth, the 98% of the total population that has ever lived on the globe has been eradicated by microorganisms. So they are our biggest enemies, and the biological disasters are going to be a very potent threat in the future. You can look at the recent examples of Ebola, which have wiped out the entire economy, infrastructure, as well as a lot of people from that country, because they are very hard to manage, and the prior risk information to such biological hazards is not available. We are also at equal threat by increasing chemical agents, which are very toxic, as well as the radiation dispersal device and radiation emitting devices. So, and it affects not only just life, but also the environment and properties. Here in a chart, we have tried to show it in a head-on matrix, how it affects life, property and environment. Looking at the databases, how we try to analyze it, the chemical, biological, radiation and nuclear events globally from the year 1968 to 2016, a very good analysis came into practice, and that is exactly what we have predicted so far. The maximum number of events that has happened so far was biological events, and the maximum number of mortalities have been happening only with the biological events. The next, as we anticipated, was the chemical. Radiation and nuclear were followed by then, and in the nuclear power plant accidents, only this 30 deaths that had happened only happened in the Chernobyl incident and nowhere else. So the threat perception, actually we need to analyze and then make an action plan on how to mainstream CBRN. Similarly, when we talk of the cost involved in developing these agents by some malicious forces as well as for capacity building, the maximum cost is occurred in the conventional weapons, the lesser in the nuclear one. Biological and chemical can be easily, cheaply produced in your neighborhood as well. With just a sugarcane juice, you can replicate so many viruses. It is as easy as that. So we pose the maximum threat from that. How we can do risk reduction for CBRN incidents, because we are majorly concerned on the accidents that happened in civilian domain. We don't want another Bhopal gas tragedy, and we don't want another Jaipur oil gas like fire. So to avoid these things in future, we need to focus on DRR strategies, and how we can do it is the standardization in safety approach. We need to adhere to the strict monitoring system to detect the far below threshold that can cause harm, and I will also come on what NDMA is doing in this perspective. The security, that nobody malicious person should not get an access. We should enhance our security at that level. Also think on the regulatory aspect, and the most important is awareness and capacity building. Again, for doing that, we'll be requiring indicators, because indicators are the only markers which show us how much we have progressed as far as CBRN mainstreaming is concerned. Monitoring is the main important thing through various equipments, but it's a very costly affair. Level of medical preparedness and availability of antidotes, decorporation agents and triage procedures is what we can very effectively do, but still a lot of hospitals in India are not very well equipped to manage CBRN emergencies. Level of capacity building, we need to think on a very deeply basis who needs to be exactly trained. Is everybody a first responder? Is everybody an incident commander? Does everybody needs to respond to site in case of a CBRN eventuality? The answer clearly is no. So we need to focus on specific group of people and train them accordingly. Awareness among the medical personnel and the community is very important measure that we need to take, and also we need to regulate the anti-proliferation measures, prevent illegal trafficking, whether through seaports, airports or land ports, and increase the level of international cooperation. Agencies, international agencies which can share us data regarding any outbreak in other country as fast as possible will help us in enabling our systems for gearing up for any such disaster. There are several initiatives which have already been undertaken by the NDMA and Government of India for CBRN and disaster risk reduction. One of the most important thing was mobile radiation detection system for PCR vans in the country. The point of entries and ports are also being equipped by radiation monitors. There have been many CBRN, many emergency management exercise at point of entries. We have done recently at many airports and also at the land ports. And even in the SARC annual disaster management exercise, the scenario of chemical industrial disaster leakage at an international level was also undertaken as a part of international exercise. Through the Ministry of Health and Family Welfare, 4 CBRN medical management facilities are coming up in 4 metros and 21 district level centers which can act as a feeder hospitals for these CBRN medical management facilities. And the DAE has established 23 emergency operation centers and 9 at the NDRF battalion which primarily take care of the radionuclear emergencies, and the strategic health operation centers which has been located in 684 districts through the Integrated Disease Surveillance Project, IDSP mechanism, is acting as a nodal strategic operation center for any biological and now onwards even as a chemical emergencies. So as we say, the capacity building is happening at all level, right from the people who handle the stuff at the airports to the community and to the first responders like medical doctors, as well as the first line defense like police, civil defense are also being trained based on their respected skills for CBRN defense. Important thing which has been recently undertaken has been, we have been working for a database of CBRN experts, and so far we have compiled a huge database of all trained CBRN experts from different parts of the country. And the CBRN medical management SOPs for how hospitals should act in case of any CBRN emergency has been recently undertaken by the city of Mumbai, and it will be soon replicated in different parts of the country. What is the exact way forward? How to deal with CBRN emergencies to reduce their effect drastically on life as well as matters? CBRN incidents, there need to be specialized community building efforts. Introduce CBDM in the syllabus. Again, when we talk of capacity building, we have to be very careful. Do we need to teach CBRN to our kids? But if we teach them, we have to teach in a way that there should be no fear in them when they encounter any such situations in the future. Develop robust emergency operation centers and with GIS